Okay, I am going to get us started today. And as people join, I will let them in from the waiting room. So welcome everyone. Oh, already. My name is Stephanie Foner, and I work on the Affinity and Domestic Engagement team in the Office of Alumni Relations here at Northeastern. It is my role to bring unique and engaging programs to our wider Northeastern community. I'm very excited to have this program here for you all today. So just a couple of housekeeping items first. Please keep your microphones on mute throughout the duration of the event just to maintain the sound quality. I will be keeping an eye on the chat box, so if you are having any challenges or any issues, please feel free to message me directly. At the end of our panel discussion, there will be a time for question and answer. At that time, or if you have any questions during the course of the presentations, please feel free to put those questions in the chat box and I will read them out loud. And then lastly, automated transcription services are available for the event if needed. You can hide or show the subtitles and or the live transcription via the CC live button in the bottom toolbar. So again, thank you for joining us today to learn about a few of the emerging technologies that are defining the future of brain health. Our focus today is on just 3 of these technologies, which are specifically being used to optimize brain health and initiate healing. Our 2 speakers today are each experts in their respective fields, using the technologies of their practice to study, diagnose, and treat brain diseases, injuries, and traumas. Rosemary Byrne is a nurse practitioner and the clinical director of Hyperbaric Medical Solutions New England. She began her career as a registered nurse on Mass General's Gynecology and Oncology Surgical Unit before becoming a board-certified nurse practitioner, developing further experience in women's health. Rosemary joined Hyperbaric Medical Solutions New England as the organization's clinical director in 2009. And our other speaker today is Dr. Jean Tunik, who is a professor of physical therapy, movement, and rehabilitation sciences, and the Associate Dean for Research and Innovation in the Bouvet College of Health Sciences here at Northeastern University. Dr. Tunik also directs the Laboratory for Movement Neuroscience, which has been continuously funded for the past 12 years. And Dr. Tunik is also an alumnus of Northeastern, having earned his BS in physical therapy from Northeastern before getting his PhD in neuroscience from Rutgers University. And now I am very excited to be handing the floor off to Rosemary.
Thank you. Thank you for the introduction. And I'm excited to talk to everyone about hyperbaric oxygen therapy, which is my field. So I'm going to share my screen now. And let's see, present. There we go. So my day-to-day work life is all about hyperbaric oxygen therapy. And then today I'm just going to explain a little bit about what that is and also how it can apply to brain health. So hyperbaric oxygen therapy is often abbreviated HBOT. And what it is the definition of it is breathing 100% oxygen at a higher than atmospheric pressure. So right now at sea level, when breathing normal air, we're breathing 20.9% oxygen. So when you're in the hyperbaric chamber, you're breathing 100% oxygen, typically in 60 to 90 minute intervals, at a pressure anywhere from 1.5 to 2.4, or often even higher, atmospheres absolute. So the ATA, or atmospheres absolute, is the pressure, and 100% is the oxygen. And when you combine those 2 pieces together, you're able to super saturate the hemoglobin. So you can really hyperoxygenate the blood, the plasma, and the tissue. And what that does in turn is it's very anti-inflammatory, can help promote the growth of new blood vessels, It improves collagen production, mobilizes stem cells, helps the immune system to function by increasing production of white blood cells. And then you also have an improvement in swelling or edema. And so a quick history of hyperbaric, but the first documented use, so the use of pressure for health is not a new concept. So in 1662, it was documented that a physician in England was using a domicilium to pump air in a one-way valve and increase pressure for health. And that was over 100 years before oxygen was labeled oxygen. So there was an idea already that pressure could be good for you. And then in the 1930s, the use of hyperbaric for the bends or decompression sickness became more widely used. And in the 1960s and 70s, medical providers and especially the military began using hyperbaric much more often. And then in the 80s and 90s, the medical field started organizing around the use of hyperbaric and doing more research. In 2000, it became a board certified or a board specialty of medicine. This list, I'm not going to read through the whole thing, but these are the current FDA approved uses of hyperbaric. So these are the conditions for which insurance will often cover, and for patients that are being treated either in the hospital or an outpatient setting often fall on this list. These are some photos of some hyperbaric chambers. So the top two pictures here, the blue chamber, that's our chamber in Randolph. We have a multi-place chamber, meaning more than one patient can go in at a time. So you can see the picture in the top right, there's a nurse helping a patient. It's a nice option to have for patients who need assistance or who have confinement anxiety. Excuse me. And then the two bottom pictures are monoplace chambers. So we're part of Hyperbaric Medical Solutions that has sites in Massachusetts, New York, and Florida. So most of our centers have the monoplace chambers like pictured below, where a patient lays down and is by themselves in the chamber. So there's two different types here. And then just a quick overview of Hyperbaric Medical Solutions. So our site has been in operation for over 20 years, treating patients. We are the only multi-place chamber in all of Massachusetts, and we're part of Hyperbaric Medical Solutions. So we have centers in New England, New York, and Fort Lauderdale. And there's info there. I can always share that after if people are looking for more information about us. So to tie in some brain health aspects with hyperbaric, I wanted to just show a few current research studies. So this study looked at patients who had had a brain injury, and primarily the graphic on the right is showing the blood flow and the blood volume in the brain before and after hyperbaric. So the study showed that patients that had had a brain injury after a course of hyperbaric, the hyperbaric was able to help induce neuroplasticity. So that's when the neural networks are able to change, they grow and change, kind of organize together. And in the past, we thought when someone had a brain injury that wasn't really possible, that once their brain was injured, that was sort of it, and they weren't going to get better. And so these studies actually showed that hyperbaric is able to help improve the blood flow, improve the growth of new blood vessels and nerve fibers, and that those changes correlated with actual improvements in the patient. So cognitively and neurologically, the patients improved. Some other more recent studies that are really interesting as well showed that hyperbaric can possibly slow the aging process. So it increased the telomere length, which the telomere is like the cap on the end of the chromosome that as we age tends to shorten. And that's often linked with disease, illness, and possibly lifespan. So hyperbaric can help potentially slow the changes linked with senility. It can help improve outcomes after stroke, even when the stroke has happened a long time ago. And that also patients with TBI is an abbreviation for traumatic brain injury. So of all severities, whether it's a concussion, a more mild TBI, or a severe TBI, that hyperbaric has been shown to have to help with cognitive improvements and brain activity after those injuries. So in summary, hyperbaric is breathing 100% oxygen at an elevated pressure. It's very useful for healing in a lot of different situations because it's anti-inflammatory, promotes oxygenation, improves blood flow. And then this is from one of those studies as well, another just larger graphic showing the blood flow before hyperbaric and after. So you can see, especially in the frontal lobe and the temporal lobe, there's an increase of blood flow after this therapy, which can then carry over to cognitive improvement, neurological improvement. So that's the end of my slides. If I am looking forward to hearing Jean and then for the question section. Okay, I think, did I stop sharing?
Yep, you're good.
Okay.
Thanks so much, Rosemary. Now we're going to hear briefly from Dr. Tunik, and then we are going to have a panel discussion moderated by a wonderful volunteer of ours. So, Jean.
Do you see my slides?
Yep.
Okay, great. Thanks, Rosemary and Stephanie and Hilary for putting this event together. I'll talk about a class of approaches that involve non-invasive stimulation of the brain. Together, this family of approaches are called non-invasive brain stimulation techniques, and they really comprise two different main classes. One uses electrical current to stimulate the brain, and the other one uses principles of electromagnetic induction to use a magnetic field to stimulate the brain. And I'll cover very briefly each of those approaches, a little bit about their history, and some of the applications for each of them. So let's begin a little bit with the electrical form of stimulating the brain, transcranial electrical stimulation. The approaches really date back to the discovery that biological tissues conduct electricity. And this was found by Luigi Galvani in the 1700s by stimulating various animal species and post-mortem humans. And he discovered that indeed, that if you apply an electric current to the body, to the muscles, you'll invoke a contraction. And that led to a number of different discoveries, both in the field of electricity and magnetism, that later led to these techniques. But it really wasn't until about the early to mid 1800s that Duchenne, who was a neurologist and really by some is considered to be the father of neurology and a class of degenerative disorders, Duchenne muscular dystrophy are named after, who really took electrical stimulation and electrical physiology to the next level. And he was very interested in understanding how nerves conduct electricity, how the brain conducts electricity. And so he started applying these techniques transcranially, so across the skull to the brain, to individuals. And so that class of applications really led to where we are today, where this class of techniques, transcranial electrical stimulation, really involves applying a couple of electrodes, an anode and a cathode, and there are different configurations for how this can be accomplished on the scalp, and then using a fairly simple device that's powered by a set of batteries, actually, to deliver a current, between the anode and the cathode electrodes. And so this is used extensively in research settings, but it's also garnered the attention of a lot of industry sectors to apply it to commercially available devices now that I'm showing here on the right, some of them for various applications. And I'll talk about applications in a little while, but this class of electrical stimulation techniques is showing some promise. The jury's still out for a number of applications ranging from improving recovery from disease to, even in healthy individuals, optimizing performance. So some athletes are even using it to sleep improvements, relaxation, things like that. So that's the electrical form of brain stimulation approaches. The other side of the coin here is really using a magnetic field to induce the current in the brain through principles of electromagnetic induction. And we owe our thanks to Faraday for that. And what he found was that if you take a wire and coil it around an iron core and drive a current through that wire, you will induce a magnetic field shaped kind of like a donut around the coil of wire. And if you put any kind of electrically conductive medium into that magnetic field, you'll induce a current in that medium. Well, just so happens, obviously, we know that the nervous system conducts electricity, as do our muscles. So if you put the brain into that magnetic field, as you can see here, that was tried by Thomson between these two large magnets, you'll induce a current in the brain. Really, this technique evolved a lot, and it wasn't until the mid-1980s when Anthony Barker really applied it to research protocols using a much more manageable, wieldly device that you're seeing here in this middle picture. And so this is basically a giant capacitor that can deliver a current that into these coil of windings that he's holding over the person's head. And the magnetic field is created here under this TMS coil, as it's called. And as the current is discharged, the electric current in the brain is created. And we can record the output of that stimulation by measuring the muscle activity on the other end, or by looking for a twitch. And I'll show you a video of what that looks like. And here what you're seeing is a more up-to-date visual of what there are many TMS devices out there on the market. TMS is transcranial magnetic stimulation. This is one of them where a patient or a participant in a research protocol will be sitting or reclined under the TMS coil. The TMS coil is attached to this giant capacitor, which you're seeing here. And there are now computerized protocols that can deliver different types of that form of stimulation. And its applications are very widespread as well, ranging, it's FDA approved for treatment of depression that is resistant to pharmacological intervention. It's FDA approved for obsessive compulsive disorder, and it's being investigated for many other pathologies, applications. So again, just to summarize how TMS works, the TMS coil is placed over the person's head. It creates this ring-shaped magnetic field that, if it's close enough to the neural tissue, transcortically, it induces a current in that tissue. And those action potentials, those electrical signals in the neurons, can be measured quantitatively by putting an electrode on the muscle to which they're connected. Just like a cardiologist might measure your heart activity with the same leads, we can measure the muscle activity in there. And so every time this activates those muscles, we can measure that as a blip in the muscle pattern. And we can quantify this blip and measure it before and after a therapy or before and after a drug intervention to get a quantitative readout of excitability in the brain. We can also get an idea of how extensive the activation is, as you're seeing in this picture here. So what you'll find in some pathologies like stroke, after a stroke lesion, there's a significantly reduced area of activation in the brain where the stroke happened. What we can measure after recovery is how that activation pattern changes. And we can also use this technique therapeutically to see if we can drive some of this type of recovery in different patient populations. So here it's used both as an assessment tool as well as an intervention tool. So I've already kind of hit on some of these points between the two types of technologies. They offer a real breadth of tools for both researchers and clinicians. The transcranial magnetic stimulation technology really is the one that's used for assessment. because of how it works. So you can measure both cortical excitability and inhibitory mechanisms in the brain. You can use it to map out different parts of the nervous system to get an idea of spatial organization. You can measure how different areas of the brain are interconnected with each other, the strength of that interconnectedness. You can use it to assess outcomes of interventions. You can use it to measure recovery from disease. And you can use it to assess how related diseases differ from each other, or what's referred to as differential diagnosis. And then on the therapeutic side, both the electrical form of stimulation and the magnetic form of stimulation can be used in a number of different areas. Some of these are FDA approved, a couple of them, and others are being really explored for, determining whether they are safe and efficacious to do. And so I list some of those therapeutic applications here, but there are many others. And then last, I wanted to comment on the side effects and the potential risks associated with this technology. I want to highlight this is a relatively new approach. It's really hit the research arena in the mid-'80s. So we have about 30 years, give or take, of research on it that is rapidly evolving and growing. I list here some of the more common side effects or risks associated with it, which are generally considered to be pretty mild. The most serious potential risk is that the transcranial magnetic stimulation procedure could potentially invoke a seizure, inadvertently, obviously. This has been very rare in about 30 years of use. There's only been a dozen cases where that has happened, and these are generally in individuals who have a history of seizures or who are taking medicine that make it more likely that they will have a seizure, or when the parameters of stimulation are set really, really high. So I think that the risks are, comparatively to other things, relatively small, but nothing is without risk entirely. Otherwise, these set of tools offer a tremendous amount of potential, both research-wise and clinically, and are a rapidly growing set of technologies. Thank you. Oh, I wanted to share a quick video, if I may, just to show you an example. Do you see the video right now, Stephanie?
Yes. Yep.
Okay. Sometimes it's a little bit hard to get an idea of what it actually looks like. And so this is me as a participant in a research setting. And when I play the video, you're going to hear a clicking sound. The clicking sound is this stimulator delivering the pulse to my head. And what you're seeing on my arm are a bunch of those electromyographic sensors recording the output of that signal. On the left here, you're going to see the signal recorded by these sensors. So you're going to see a bunch of blips over here. That's the recorded signal from the stimulation. And on the right, you're seeing my brain and the person navigating over the brain, which is a pretty common procedure, so they know what part of my brain they're stimulating. So I'll play the video, and about halfway through, it's a 30-second clip, about halfway through, you're going to see my arm twitch as a result of the stimulation. And that's intentional, because they are activating those nerves that control those muscles. So here are those blips recorded from my muscles, resulting from the pulse. And right now you can see my fingers twitch over here briefly. There it goes, as a result of the pulse. And so, whoops, sorry, I didn't mean to do that. And so what's happening is that the activation of those neurons is being transmitted down, crossing over, going into my muscles, and causing those muscles to twitch. That's one way of delivering that stimulation. Thank you.
Great, thank you so much, Jean. And now we are going to transition to our moderated discussion. Our moderator today is Hilary Loftus, who is a proud Northeastern parent who is a volunteer with our very active South Florida alumni and parent community. Hilary's career has spanned program development and marketing for over 25 years. After leaving her marketing and program development position at a physical therapy services clinic in Connecticut for the warm South Florida weather 6 years ago, she learned about the Howe Foundation helping veterans with medical grade hyperbaric oxygen treatment from a family physician. At Howe, she found she could combine her past career experience with her background and interest in healthcare and the brain. Hilary is excited to be working with the Howe Foundation, her colleagues, Howe's supporters, and a great team of college interns to help concussed student athletes and equestrians recover their brain health. So now I'm going to turn the floor over to Hilary, who is going to lead our moderated discussion.
Unmute myself. Thank you, Stephanie. And great presentations, Rosemary and Jean. It's amazing that we know more about what's going on in the surface of the moon than we do about our own brains. But I think people like Rosemary and Jean are helping us cross that barrier. And I think in the very near future, we're going to learn so much more. And we'll be able to navigate that landscape. And I'm very excited about that for our generation and for future generations to come. And excited to be here. So let me ask some questions so we can dive a little bit deeper and learn a little bit more about this field and our presenters. Let's see. Jean, you were just talking a lot, so I'll give you a little break and I'll go back to Rosemary and ask her this first question. Rosemary, what drew you to this line of work that you do with hyperbaric oxygen therapy in the brain and to the specific technology that you work with?
So I came into the hyperbaric field in a little bit of a roundabout way because my family was involved in hyperbaric medicine. So my mother was a pulmonologist and became board certified in the early 2000s in hyperbaric medicine as well. And so I was still in nursing school at that time and just learning a lot sort of by talking to her and listening to her. And then when my mother passed away and I thought I temporarily filled in at the center to bridge the gap, and that was 13 years ago. So once I started really working in the hyperbaric field full time, I didn't want to leave because I enjoyed working in a field where I really saw it making a difference in people's lives. So whether we're treating our patients for radiation injury or a diabetic wound that isn't healing or sudden hearing loss or a concussion, seeing something that is really providing some hope for people who may have been really feeling like they were, failing. We say that things failed certain therapy. And so a lot of our patients come to us pretty disheartened, and to be able to offer a medical therapy that in general is very well tolerated and seems to really help a lot of people just has kept me involved.
Great, thanks, Rosemary. And Jean, what about to you? What drew you to your line of work and to the technologies that you work with?
Sure, thanks for asking that, Hilary. I started out working clinically with patients, and I was just deeply perplexed by the different pathologies and what was happening under the hood, so to speak, of the pathology, and why some interventions worked and others did not, why some people responded to some interventions and others did not. And so I really wanted to pursue the hows and the whys of the clinical world. And the brain was an obvious target of interest for me. It's a 4-pound mass of jello with 100 billion neurons that are all interconnected to thousands of other neurons, and it gives us things like creativity and dreams and movement and all other functions that we generally take for granted every day until a certain disease hits. And so I really think that understanding the workings of the brain, of the nervous system, is really kind of one of the biggest unsolved mysteries that's going to keep us busy for the next century at least.
Great, thank you. Okay, so my next question, I'll go back to Rosemary with this. What are some of the most exciting applications that you are currently seeing with your technology?
So in our center, we treat a lot of indications that are covered by insurance, meaning FDA approved. We call it on label, and then a mix of some off-label indications. So it is exciting, even in the cases of patients where there is a lot of data, but to see someone who has failed other therapies, like someone with radiation cystitis, so the bladder lining is bleeding because of a history of radiation, to see them finally start improving and their bleeding slow down and their quality of life improve. And then in the years that I've been involved, there's been a lot of headway in the research on post-concussion. So that has been very exciting to see it be more and more commonly used, treating patients that are suffering from long-term effects of a concussion or multiple concussions. And so the more and more research that just keeps adding to that is currently very exciting.
Thank you. That's very close to my heart. Okay, Jean, what about you? What are some of the most exciting applications that you are currently seeing with your technologies?
I think that there are a number of areas where brain stimulation is really becoming an exciting field. First of all, as the devices become smaller, and as the users of the devices are able to control different parameters on those, we're starting to see more widespread use. And that obviously beckons more research that has to be done to understand whether its utility is helpful for various things and safe for different populations. So the doors are open in so many fields that are really exciting. For example, it's being used right now more commonly for pre-surgical mapping of different areas of the brain to improve the outcomes and the efficiency of the surgical procedure, because sometimes doing mapping before surgery is very difficult, especially in children who can't go into an MRI machine so easily. So using it for pre-surgical mapping for tumor resection is becoming more accepted in certain places. It's being looked at for use in the general population for, meditation, sleep, things like that. So again, we don't know what the optimal parameters and protocols are. This is all under investigation, but I think that these all are very important applications that are exciting. And then the third area is really understanding which targets in the brain to engage. What are the specific parts of the brain that we need to stimulate to get the desirable effects for a certain application? And so we still don't know that for many diseases. We do know that for a couple that are FDA approved, but there are certainly other targets of engagement, and certainly new ones yet to discover for other pathologies. And so that's a really exciting area too.
Very exciting, and great to know that it maps the brain for brain surgery too. I didn't know that. Very useful. I think we covered, or Jean covered a little bit about exciting future applications for these technologies. But Rosemary, let me ask you, do you see any exciting future applications for medical grade HBOT?
I think there are a lot of potential options in the future, and the way I truly believe it's an underutilized therapy. But what I think is interesting about, since the focus of this talk is brain health, is that so many patients that we see who have had concussions are told that their imaging is normal. So the ways that we have of diagnosing and looking at brain injury, a lot of times the patient is told they're normal, but they know they're not feeling normal and that their life is not normal. And so by seeing them improve with hyperbaric, that can help us shift that focus and then say, okay, what is hyperbaric doing that is then helping them, and kind of work backwards to maybe have better tools to diagnose people earlier so that they will heal sooner and get better faster.
That is very exciting. Look forward to that. It would be great if they could tell, right away on the playing field if someone did have a concussion, or at least afterwards, and be able to do something about it.
Right.
Jean, do you have anything else to say about beyond what you said about future applications for the TMS and the brain, what you're doing with technologies?
I can add one other thing. I mean, there are the other really big development is on the device side. The devices are becoming more versatile, so that we can have more control as a user of the device to activate more specific neural circuits in the brain than we're able to do with prior devices. And this is a really exciting development on the technology side, because it's going to give clinicians and researchers a lot more control over how they use this stimulator and how to study specific, more granular circuits in the brain. And then when it comes to treatment, some diseases have very specific circuits are affected in certain diseases. So it will provide more of a scalpel type of therapeutic approach for clinical application. So that's a really exciting development. And if I can just put a quick plug here, Northeastern just got a large grant to buy one of those types of instruments that we're expecting to be here in January. So we're really, it's going to be the only one in the New England area. So, and only the second or third in the country. So we're really excited to be on the cusp of that.
Very exciting. Northeastern innovation once again. My last question, and I'm just really so excited about what we're doing today and all this knowledge and information for, it's going to help so many people, and we're just all learning so much and more to come. So my last question is, how will these technologies advance our understanding and treatment of the brain in the future? Do you have some thoughts about that, Rosemary?
I think that, not to sound redundant, but it sort of ties in with what I was saying before about, when we know that hyperbaric is helping a certain diagnosis or a disease or condition, then we can work backwards to maybe figure out how to better diagnose or notice that condition. So with brain injury or concussion, we know that when we look at their imaging, it looks okay, but clearly something's wrong. So what's happening on a more cellular level, that the oxygen and the pressure are able to help make changes and induce some of that neuroplasticity and the growth of new blood vessels that we can't see in our typical routine testing.
So working with more refined and specific and sensitive diagnostic tools. Mm-hmm. Excellent. And Jean, the same question to you. How do you see TMS and your technologies advancing the understanding and treatment of the brain?
Sure. So, yeah, I'll probably sound a little bit redundant with what I said before and with what Rosemary is saying, but many other technologies out there that are valuable tools to understand brain function, EEG, fMRI imaging, things like that. What distinguishes TMS from many of those technologies is that those technologies tend to be correlative in nature. And in other words, what I mean by that is that when you measure somebody's brain signals using fMRI or EEG, what you're doing is you're saying a certain behavior is associated with a certain change in brain signal. It doesn't establish that causal relationship. It doesn't establish that that brain region causes that behavior. It just establishes a correlative association. What TMS allows us to do, and it's really the only non-invasive tool that we have that allows us to do this, is it allows us to establish a causal link between brain and behavior, because we can actually perturb brain circuits. We can activate them, we can deactivate them, and then we can observe the change it has on behavior. So it's, in that regard, it's really a very distinguished tool from anything else that we have out there as neuroscientists to study the brain. And from a therapeutic side, it really is a very versatile tool because it allows you to both affect circuits at a global scale, widely across the brain, but it also, depending on how you use it, allows you to affect local circuits. And so there you have the flexibility therapeutically to use it at a different, scale, either locally or more systemically at the brain level. So again, it's a very powerful tool.
Very exciting. I see some great possible connections and collaborations in the future, but that would be the topic of another conversation. Thank you so much. And that's all we have for questions, unless there are questions from the audience to be addressed. I'll turn it back to you, Stephanie.
Yeah, thank you. Thank you so much, Hilary. The floor is open for folks. You are free to either send me a direct message with a question, put your question in the chat box, and I will read it out loud. I did get a couple private messages already, so happy to get us kicked off while folks think through some questions they might have. As most participants on this call probably know, Northeastern is a very proud hockey school. So the mention of concussion treatment was one that pinged some interest that Rosemary mentioned. Rosemary, could you explain a little further what the treatment for concussion looks like with the HBOT technology and what you hope to see in the future?
Mm-hmm. So typically when we treat a patient who has a chronic traumatic brain injury, they've had a concussion, in the past and now have residual symptoms, it's usually a series of sessions. So patients come to our center ideally 5 days a week. They're usually in the chamber for around anywhere from an hour to 2 hours, depending on the protocol. And they're breathing 100% oxygen at an increased pressure. So all of our diagnoses, we tailor the pressure and the time based on what their diagnosis is. But most patients are coming repeatedly for a series of sessions, often up, around 40 sessions is probably an average for most of our patients. So it's a big time undertaking and logistically a big undertaking, but it's a very well tolerated. There's very few side effects and most patients feel pretty good while they're having therapy. So other than the time commitment, then it's not a bad experience. So.
Great, thank you. So in general, obviously our focus is things that go well or successes that we've seen, especially in research, but we do know that through the process of research, sometimes we get unexpected results, or sometimes things don't turn out the way that we hope for in some of our studies. Jean, can you talk a little bit about if you've had any setbacks in your research or pivots that you've had to make when things maybe appear differently than you had anticipated?
Yeah, that's research.
Yeah.
So, for better or worse, we always encounter hurdles and challenges, and sometimes our hypotheses don't work out the way we thought they might. We encounter technical challenges all the time. So we always have to be ready and willing to pivot on our ideas, to explore other hypotheses that are related, to try to really get a thorough picture of what's going on. I think that it's a very incremental, research tends to be a very incremental and slow process. For every win, there are probably 5 or 10 losses or disappointments or hurdles to get through. But that's where the fun is. And the other big change now, I don't know if this touches on your question or not, but research has evolved a great deal over the past decade or so. And so conducting research on your own right now is virtually impossible. And so in order to get anything done, you really have to form strong teams of collaborators that have varied expertise in neurosciences, psychological sciences, technology, computational science, engineering. So it really takes a village to do any kind of impactful research. And so when you read about discoveries that are being made on the clinical side or on the research side, behind those discoveries is a whole big team of investigators that have been able to make it happen. And so that's a wonderful development. And really Northeastern, I think, stands out from the pack of other institutions by fostering these types of collaborations. So really happy to be part of the Northeastern team on that.
Wonderful, thank you. So both of your work touches upon treatments and thinking about the future of brain health. Are there specific increases of some traumas or injuries that we think might be the future of brain health, or are we seeing a lot of the continuation of similar injuries and traumas? As we're thinking about these technologies applied to the future of brain health, what does that treatment look like? We can start with Rosemary.
I think we're probably just diagnosing certain injuries and traumas better and more often. Would be my thought. I'm not as much of an expert in that aspect of it, of knowing sort of the trends and in what injuries are more prevalent. But I would think there's definitely been such an increase in terms of doing baseline testing especially for athletes to have a better idea of when they've been concussed and being more proactive in terms of having a treatment plan for students and patients when they do have a concussion. So my thought is that there's probably a similar rate of concussion, but we're not overlooking them as much.
What about with strokes? I'm wondering if there have been any developments with strokes as well, talking about another kind of brain injury.
Yeah, so I mean, some of the more recent studies are showing a lot of, my focus is on the hyperbaric research around stroke. And there are some more recent studies showing that hyperbaric can be very helpful after a stroke, even when it's been a long time since the stroke, in terms of revascularizing that area and improving some nerve regeneration. I'm not sure if that's what you meant by your question, or if I'm not sure of a change in the prevalence of stroke. Again, we're probably better at identifying and diagnosing.
Right, and treating. And with stroke and concussion, does it make a difference if someone gets to your chamber, your technology sooner rather than later? Do you see a greater improvement in patients when they get there, not long after they've had a concussion or stroke, or does it not matter?
Right. So in all of our diagnoses, I think, often the more time that passes, it's harder to correct the underlying problem. With concussion, there's also some research looking at doing a shorter course of treatment right in the acute phase of concussion, but it's obviously still very investigational. All of hyperbaric's use for concussion and stroke are still investigational. And with stroke, it's a little trickier. We have to be careful initially in those acute phases of treating, but when we tailor, and that's what at Hyperbaric Medical Solutions, that's what we do, is hyperbaric medicine. So we're very careful, and we evaluate every patient ahead of time and tailor a course that's individual to them to help for their best outcome.
Great. And Jean, what about with your technologies and your expertise? Do you see a difference between working with someone that's had a concussion recently or a stroke recently versus a long time ago?
What we're finding with stroke is that that individuals who we used to think were fully recovered by 6 months, for example, after a stroke, can make remarkable gains even at those longer phases after a stroke, given consistent and proper interventions. So what we're seeing is that the brain is a lot more resilient and plastic than we originally thought. There's a lot of research right now going on to figuring out really what are the protocols, what are the ingredients to maximize those types of outcomes. Is it any kind of movement therapy or brain stimulation therapy? Is it something specific at a specific time point? Is there a critical window? These are all really unanswered questions, but what we do know is that the potential for recovery is probably much bigger than what we thought. We are seeing an uptick in strokes happening in younger individuals. These are individuals who are like 25 to 50, 25 to 60 years old. This was a demographic that had a pretty low incidence of stroke in the past, but over the past decade or so, 10, 15 years, there's been a pretty sizable uptick in the incidence of strokes in that demographic. The jury's still out about what the cause of that is. Those individuals tend to have more subtle types of deficits that are maybe not often as obvious on the surface as they might be in somebody who is older. But the deficits or the challenges that these individuals are faced with are pretty substantial because they're still a working age and there's oftentimes raising families, and the challenges that they face relate to things like dual tasking, like performing a cognitive task, like preparing a meal while moving around the kitchen and answering questions. So when you have to process multiple pieces of information like that, that's when things start to break down, especially in those individuals. So there's a lot of research going on to seeing how to maximize outcomes in stroke in these different demographics. On the overall brain health, that you asked earlier, I'll say that a big part of brain health really is also not about what you do later in life, but also what you do earlier in life. It's about creating a resilient brain, right? That's going to get us through many of our years ahead. And so nutrition, diet, proper sleep, physical activity, all of these things are really critical in our formative years in order to get our brain to a point where in our later years it's resilient to pathologies, recovers quickly, things like that. So when we talk about brain health, I don't want to have the conversation focus on just our adult years. I want people to be aware it's the earlier years that are really important in setting the context.
Great. Thank you.
Yeah, so I don't see any other questions in the chat. Last call, I'll make a little announcement. This event, as I'm sure you're seeing, is being recorded. I will be sending out the recording before the end of the week, so please keep an eye out for it. And again, thank you to Rosemary, thank you to Jean, and thank you to Hilary for such an informative and wonderful presentation and discussion. And thank you to all of you for joining us today. Hope to see you again soon. Have a wonderful holiday season. Bye, everyone.
Thank you.
Thank you, Stephanie. Thank you.
Thank you.
Everyone.